This short video is intended to assist you as you understand patients' results with respect to progesterone. So from what we understand or how the data was entered into the system, this is assuming that the patient is in a postmenopausal state or is not ovulating for some particular reason, but most commonly because they are postmenopausal. So you can see on the report on page 1 for the two progesterone metabolites, you'll see the reference ranges for a luteal, which is going to be premenopausal, and then postmenopausal. So as we plot them on the graphical page, then the premenopausal range is going to be this upper part here between the stars, and then the postmenopausal range is this little purple band here. So as you see a patient's results like this, you would see that both of these values are in the lower part of, but within the postmenopausal range. So this is much lower than you'd expect to see in a woman who is cycling, but expected for a woman who, again, is not cycling. So this would be considered low if she's premenopausal, but perfectly normal if she's postmenopausal. So a couple other scenarios you might see in these types of women. The woman on the left here, you can see the one progesterone metabolite is just below the reference range, so well outside of the postmenopausal range. And then the other metabolite is even further up into the premenopausal range. So what we're showing here for progesterone, being a weighted average of the two, puts her up into the premenopausal range. The woman on the right here, you can see that both of these values are extremely low. So on the one on the left, that's going to be sort of a low normal picture if you're premenopausal, but high if you're postmenopausal. Not necessarily meaning that's problematic, but compared to what's expected, that's a pretty high number for a postmenopausal woman, which could be coming from if she's actually ovulating, or she just happens to make more progesterone than the average postmenopausal woman, or if she's supplementing and forgot to tell us that she was supplementing with hormones. On the right, you can see a woman who, I guess this is actually a male report on the right, but if a patient is even below the range for progesterone entirely, like these really, really low numbers, when you hit postmenopausal, then most of that progesterone is coming from the adrenals. So if you have patients with very, very low adrenal output, you can even be, sometimes lower than the postmenopausal range. So just a couple collection here of abnormal results. If we go back to this first one where the woman is on the lower part of the postmenopausal range, and we want to see, is she estrogen dominant? What we'd be looking for with this particular report is a lot of times with other tests where you just have progesterone and estradiol, what they'll look at is a ratio, which isn't really appropriate when you've got the whole family of estrogens. So the way you would look for potential estrogen dominance is just asking the question, which has a higher value in a relative sense. So if you look at the estrogens here for this patient, they're on the upper end of that postmenopausal range. The estriol is even out of the postmenopausal range. Same with the 4-hydroxyestrone, the 2-hydroxyestrone, but they're all higher within that range than is the progesterone, which is on the lower end. So this patient may or may not experience symptoms of estrogen dominance, but just in terms of conceptually how this is generally looked at when we're looking for estrogen dominance in a woman who's no longer cycling, those would be the types of things that we're looking for, is in a relative sense, which hormone is really predominating. And in this particular case, there's somewhat of a moderate predominance for estrogen as opposed to progesterone, and that may be something that a provider would want to look at. So I hope that's been helpful. Please do feel free to see our other videos in this series, which will address other types of scenarios and results as you try to complete the picture for your patient here with respect to progesterone.